Good evening. I'm Gracelyn Guyol, and welcome to Restoring Health Holistically. This evening, my guest is Dr. Chris Lachowski. Welcome, Chris.
Thank you.
Dr. Lachowski is a pioneer in the integration of a wide variety of natural therapies. He attended State University of New York and received a bachelor degree in biomechanical engineering. He graduated from the National College of Chiropractic and is a chiropractic family physician licensed in the state of Connecticut since 1988. While in chiropractic college, he worked as a biomechanical engineer for the NCC Spinal Ergonomics and Joint Research Lab, contributing to research in low back pain and research in a low back pain study. Dr. Chris has certifications in radiology, acupuncture, physiotherapy, and lifestyle medicine with postgraduate training in integrative natural medicine, functional medicine, and herbology. He is a board-certified clinical nutritionist and board-certified in occupational health to design health and wellness programs. He is also a certified ergonomic specialist and is a sports medicine consultant for many athletes. He stays active as an outdoorsman, triathlete, cross-country skier, and tennis player. He lectures frequently in southeastern Connecticut, promoting a community Live Healthy for Life campaign, and is an advocate for green living and maintaining a clean environment. His office, the Natural Family Health Care Center, is at Flanders Plaza in East Lyme. I'd say you're a terrific example of the value of continuing education and physical motion. What drives you?
Well, thank you for the introduction, and I've always been desiring to learn, so it's always been my drive. But what inspires me the most over the years has been just watching Olympic athletes and watching how an Olympic athlete can achieve an optimal performance. And it's always intrigued me how to learn about how a person can achieve that level of performance in their life.
Right, right. So you feel that we have a great opportunity at this moment, time and place for achieving optimum health?
Yes, one of the things that I find for many people is that they just accept the way they feel and don't realize that they have some ability to do more to help themselves.
Okay.
And we're living at a time where we have a great opportunity, and actually the best opportunity in history, to really live a longer life and improve the quality of our lifestyle. Many people are really unaware of a lot of the recent developments and technologies that are available to everyone. And unfortunately, these are underutilized. They're not being actively implemented.
Right.
And many people are just missing out on this opportunity of using these new developments to enhance their quality of life and to be able to live a longer and healthier life. One of the changes that that has changed in our office over the last 10 years, that we've started to transition and shift away from just treating individuals for conditions that they come in for, and to start emphasizing how to live a higher quality of life and a wellness-based type of approach.
And on an integrative approach where you're not just, everything in the body is connected. So
Yes.
You're not just treating one thing. You really have to look at the whole to make some substantial change. What is the first thing that you recommend people do then?
Well, the first thing is, in these economic times, we have to get our bodies in tip-top shape. And we have to also prevent the onset of a chronic illness, because it's just too expensive these days to be sick, and it can also be an extreme financial burden.
That's right. That's right. So, what are the things that cause a loss in vitality and premature aging?
Well, we have to realize that actually every day we live, there's a silent change occurring in our bodies. We're aging a little bit every time. And we're in this battle, basically, against the forces that create unhealthy processes in the body, which can lead to premature aging and also an unhealthy lifestyle. So chronic back pain or arthritis, leads to inactivity and a less enjoyable life. Fatigue and loss of vitality can affect your ability to have a nice, productive day. abdominal weight gain that we see in many individuals. They're complaining of belly fat.
Right.
Is a very high risk factor for heart disease. High stress can deplete our hormones and then lead to immune system difficulties or problems, and also affect our memory and other factors. And then we have processes like oxidation and inflammation, which can lead us to have, it's actually one of the accelerations of the aging process, but also can be a cause of other illnesses.
Yes.
And we're exposed to many toxins in our environment these days, which can affect our energy, but also be a cause of cancer, potentially.
So the fact that such a big percentage of Americans are seriously ill is a combination of all of these factors, and you can't just address one. You have to sort of look
Yes,
at the total, and that's what you do. So, but tell me, what does personalized medicine mean? I keep hearing about personalized medicine. What's your version of that?
Well, this is a good example of the exciting time we live in, because we are actually now able to personalize care. You know, we're in a new age, and it's called the age of personalized medicine, and it's moving forward at a rapid pace. And it's going to be truly the future of healthcare, but it's available to us now, and not many people realize that. And personalized medicine basically means ways to start identifying your unique biochemical or bioindividuality.
Your causes. And
Well, actually more
usually.
the individual person's uniqueness.
Right, okay.
And so we have, just how, if you look at individuals, how they look different in appearance, we have to realize that internally, metabolically and physiologically, the way their body operates is also genetically unique to each person. And that also renders the person, you know, having also unique needs for nutritional factors that are different for everyone. So we start looking into the ways to evaluate somebody based on their individuality, and also designing treatment programs and even wellness programs that are based on a personal body type and personalization along those lines.
Okay. So, so people come into you and you say, "How are you?" and they say, "I feel fine." Then what happens?
Those are the three most dangerous words I can ever hear someone say, because many people are just getting by. And they're not truly healthy.
But they're used to the way they feel.
And they just accept that this is the way it is. I'm getting older, and there's nothing I can do about it.
Okay.
And I think in many ways, you know, the first step is to start redefining health.
Okay.
And what we mean by being healthy, and actually defining it in a different light. Many people just think that when they get their annual blood test and it comes back and says, you know, the blood test is normal, and they assume that that's healthy.
Nothing's out of range.
But health, I think, needs to be redefined in this context of personalized medicine and wellness. I think we need to redefine it to a higher level or higher standard that people can live up to. And so a better definition of being truly healthy would be, you know, do you have a high level of natural energy that's present throughout your day?
How's your energy? Okay.
Do you have an ability to recover quickly from when you're under stress, or from physical exertion, or even during an illness? They say one of the signs of a healthy person is that they're able to bounce back and they're able to recover quickly from an illness or an infection.
Right.
To be able to feel motivated and positive and productive during your day.
Yeah, a lot of people have a hard time getting out of bed.
And you want to be able to get up and go and
Right.
have that,
And feel like
that
it.
youthful kind of approach.
Exuberance.
You have to have a good appetite for high quality foods. Many people, unfortunately, they reach a point where they lose their appetite, and that's actually a sign of poor health. We want to be able to have a good quality sleep and be able to achieve deep sleep.
That's a big challenge for a lot of people.
Yes, and sleep issues are one of the symptoms that we talk about very commonly with individuals, and that's one of the big areas that we focus on. We should have a sharp mind with good memory and focus. We should have good thinking we and ability to make decisions. We have a high level of lean muscle mass and strength. Your body needs to be physically strong.
Right.
We should have good posture and balance and ease of movement and activity. To have a high level of stamina during the day. And to not get colds or feel sick very often, and to be able to be cheerful, feel happy, and also express affection and love is actually a sign of a person being healthy.
So that's that's a great definition, very definitive list of things to look for that a lot of people might not consider in total. And I think that your approach is very exceptional. So. The U.S. spends about twice as much as Japan on health care, but yet we live 5 years less on average and lag in results in a lot of fronts. I think in terms of child mortality in this country, we're 37th, according to the World Health Organization. So what do the statistics show about aging and lack of health, chronic illness?
One of the biggest areas is the fact that we have this growing epidemic of just unhealthy aging and chronic illnesses that people are living with for many, many years.
Mm-hmm.
And so statistics show that many people live with fatigue and just don't feel well on a daily basis, but really don't know what to do about it. Many children and adults now are overweight. They say it's over 60% or so.
Yeah.
50% of men and women have chronic pain on a daily basis. 70% increase in the onset of diabetes in 30-year-olds. Diabetes was unheard of, many years ago until later in life, but we're finding it in earlier and earlier ages.
And they're even finding it in school children.
And it's becoming seen in teenagers now too.
Yeah.
Heart disease is still the #1 killer of many young Americans, individuals in their 40s and 50s. Many Americans are living with arthritis in their 40s, which is very early in life.
Again, that used to be an illness of aging.
Of later on.
Yeah,
of
the elderly.
Older lifespan, yes. Depression, anxiety disorders are very common in many individuals. And we are now finding Alzheimer's cases are being diagnosed at a rapid frequency in these days, and predictions of it being higher in the future as well. And the fact is also, the statistics show that a single, chronic illness may cause bankruptcy in many cases.
Especially, again, the World Health Organization says mental illnesses occur in 1 out of 4 people around the world.
Okay,
that's so it's a very expensive illness because it's chronic, and unless you know how to treat it holistically, it goes on forever. And Alzheimer is considered an epidemic because of the rate of increase that they're seeing now.
Yes.
In younger people too.
I would agree, very much so.
Well, it's officially classed as an epidemic. So tell us the key to preventing chronic illness.
The key to preventing chronic illness is to not wait until you have a chronic illness.
That's very smart. Prevention. Okay.
Chronic illness is the biggest concern now in the next quarter century, but also, as you said before, it's the most expensive to treat, which
because
we're just not prepared for in that sense.
So why is this happening? What's going on here?
Well, I think, #1, that people are just really out of touch with their own bodies and how they feel on a daily basis. Many times we're not identifying with signs and symptoms early enough. We have to be able to start recognizing that symptoms that you experience are your body telling you that there's some trouble brewing, and we have to identify with those early enough and not just ignore them. We need to realize that a symptom is a warning signal. It's like the light flashing on your dashboard, on your oil light flashing, telling you need oil, but it's a warning signal that we have to recognize. Many times, many individuals just lack a deeper knowledge about how to manage and keep the body healthy and all the different components of that. And so we need to also go beyond the understanding of food and start reconnecting, because a lot of people have lost the connection with food as nourishment.
Yes.
And they've become sometimes concerned that their food is just an enemy making them gain weight.
Right.
And we've lost this important connection with our food, which is really what it should be, is our nourishment.
I tell people to consider food as fuel.
Of course.
And do you want high octane or do you want sugar water?
That's a very good analogy.
Because the only fuel that our cells have is what comes in through our mouth.
Yes.
And so if it's bad fuel, then it doesn't have nourishment. So you eat too much because your body keeps saying, more, I need more, I need more, because it's not getting the nutrition. It's getting all those empty calories and sugary stuff and lots of high calories and not very little nourishment.
Yes.
So I think that you're right in saying we need to redefine what people think food is. It's basically cell fuel. It's what you fire up your body with. So, so other than changing the definition of what food means to most people. What do you think we need to do?
Well, number one is we can't just afford to try to treat disease. Okay, we need to start to learn to live in a state of what's called functional wellness.
Okay.
Okay, and getting our body in a healthier state. And so number one, we need to begin to listen to our body and listen to our symptoms, because they're telling us something is wrong. And we need to interpret those signals and those symptoms as your body talking to you, telling you that there's an imbalance somewhere.
I just wanted to comment on that too, because a lot of times people, if they have a symptom, they immediately take a pill to suppress it.
Yes.
And that's not the thing to do, because a symptom is a message loud and clear from
Yes.
your body. Something's wrong here. And so you need to look at that symptom and think, what's causing this? Why is this happening? That's question number one. Okay,
Yes.
then carry
and so
on.
as you become more in tune with your body, you start recognizing when these symptoms occur, what they mean, what the cause is, what they are basically telling you. And you use that information. That's valuable information.
It is, but
to
you have
help you.
to ask your question. If I get a headache, and it's rare, I always look at what I ate in the
Yes.
last meal or the last 24 hours. What in there might have given me a headache, because I had a lot of allergies. But I think it's also other, the question is to ask yourself, what might be causing that?
Exactly.
Okay.
Yes, definitely.
All right, and then after you learn to listen.
And the next step is to start making a commitment, to make change, okay, and be able to follow through. And to sometimes we have to challenge our beliefs, because we have certain beliefs about the way things are about a treatment, but we have to understand there may be a wider scope of treatment available to us, of other options. And we need to expand our understanding, okay, about how the body functions, about wellness principles, okay, and actually how to live a greener, healthier lifestyle.
Right.
Learn how to cook better. Learn about foods and,
Yes.
and their characteristics and the different types that you need. We also need to start asking the right questions, okay, about what's happening in our body. And we also need to start identifying our body type, and this is where personalized medicine starts to come in, where we can start looking at and assessing your own bioindividuality. And testing what are called functional biomarkers, which gives you a clue of what your body's bioindividuality is all about.
Okay. So what are the right questions to ask?
Well, first question is, what can I do to change my lifestyle to promote a healthier function of my body?
And what are a couple examples of that?
Anything from what can I do to exercise, eat better, learn how to cook, learn some new skills, learn how to meditate. There's many, many things that a person can learn how to do that are going to help.
So it depends on what they're feeling. What I looked at when I was on my healing journey over the last 17 years, I looked at what's the thing that's bothering me the most in that particular moment, time frame.
Okay.
And then I addressed the most urgent thing first.
Yes.
And then
prioritize.
it was like peeling layers off an onion. Underneath that, there were often other things that were contributing to that. But it was and think of it as a process of healing. It's
Yes.
not going to be like this. I mean, people want drugs because they get this, but then they're on the drug forever, unless they solve the cause.
Yes.
Okay.
You make a good point, because sometimes people take on too much at one time. So they get overwhelmed.
Overwhelmed, and they can't
and
follow
they get
through.
frustrated and they can't follow through. So like you say, you should start very small, one little thing at a time, and put together a plan over time of all the necessary parts, and that'll develop into a full-blown wellness plan for a person.
Right.
We need to also start asking about the questions, what is causing these symptoms, like we were talking about. Specifically, start looking more into the cause of symptoms and not just jumping to something that takes away the signal and gets rid of the symptom. We don't want to be suppressing symptoms
It's like
for too
killing
long.
the messenger.
Yes, and we don't want to keep suppressing these messages, and by masking it with medications, we want to be asking the question of what's causing the symptom, and investigating and looking deeper and deeper into that.
And when you start to look for causes, then that leads you to solving the real
puzzle.
cause, but it also leads you into understanding the need for prevention.
Yes.
Once you get through the crisis, then I don't stop. I still look at, well, gee, my digestion still isn't working quite right, even though I solved a lot of my allergies. So then it moved me from crisis stage into
Yes.
prevention and seeing that as the route to maintaining health.
It's like a puzzle. You're trying to put together pieces of a puzzle, and that's your own life. That's your own reflection of things.
Right, and everybody's puzzle is going to be unique.
Yes. So we also ask questions about what am I predisposed to genetically, because many people have family risks.
Yeah,
So we
my
can
mother
now-
was bipolar.
Okay.
I was bipolar. My great-grandmother probably was. Didn't get diagnosed in those days.
Yes.
So that's part
so
of it.
personalized medicine has some options there, because we now can do genomics testing in individuals and see if they have genetic family histories that can lead us to better prevention programs. And many times also asking the question of, is a person just showing signs of chronic stress? Stress itself can be a huge promoter of unhealthy aging and illness.
It is. I think stress is probably the greatest cause of all of the illnesses in the United States.
I think they say almost every office visit to a physician has something to do with some kind of a stress response of some sort, or a stressor.
And also, when you're under chronic stress, and I think most people living in our culture are, because they're overbusy, they're trying to do way too much, and our society really isn't equipped to do all the things we're trying to do. And chronic stress elevates the hormones,
Yes.
and the stress
driver.
hormones interact with all the other hormones and throw things out of balance. And so you have this
Cascade.
Cascade. And a lot of it starts with stress. I know a lot of cancer patients can identify when they believe their cancer started because they were under such extreme stress.
Yes, so it's a very powerful agent. So
It is.
we should always ask the question, is stress causing my health problem?
And if
'Cause that's-
so, how can I simplify my life so that I'm not under chronic stress or putting my children under chronic stress because I'm overscheduling them?
Yes.
So, okay.
And the last big question is, what do I need to do to stay healthy?
The key question.
The key question.
Okay, I want to spend the next 40 minutes going into some of these things in depth. We've sort of paved the way into the subject of
Yes.
wellness that you specialize in helping people find. And so what is the generic wellness message of eat, right, sleep, and exercise is too general. So answer what we should be asking.
Yes, I find that many times when I interview my patients over the last 20 years is that I basically ask the question, I say, what are you doing to stay healthy? And every single person has a whole different answer to that. There's never one particular pattern of what people are doing that's going to lead to a healthier wellness outcome. And so it's all over the place. And many times, the generic message that you get is just try to eat well, try to get some sleep, try to reduce your stress, and exercise. But I find that many people are not just doing those even very well.
Well, you don't get educated in any of those things in school.
That's true.
There's very little about dietetics or about food and how it impacts the body and impacts health. There's nothing about sleep in there. And a lot of kids can't sleep, and nobody seems to address that except the beleaguered parents who
Yes.
get desperate. And then now I'm seeing that some schools are no longer requiring any physical exercise, even though the state statutes mandate it in schools. So
That's
they get no
unfortunate.
physical exercise.
Because exercise is such a powerful force in
It's
health.
essential. I mean, humans evolved having to walk and work and exercise. Our bodies are meant to be moved. And so I think that this functional approach, you're the teacher, because people don't know what that means.
And that's redefining the role of a physician these days. The physician should be the teacher, and we call it a coach now.
Right.
Health coach.
Health coach, all right. That's a good term.
And I think we need to expand this concept of wellness message. We need to expand it in the area of using that definition, which I used earlier about being truly healthy, trying to reach that criteria.
Right, going for optimum health.
Looking for optimizing your health in those areas. But we also need to apply this more integrative, personalized approach. And this is where the new age of personalized medicine is really going to help us become more specific, actually become more precise about designing a wellness plan that's going to work for us in the best way it can. And so we need a new model.
And has functional medicine stepped in to fill that model? That's the latest title for this. What does that mean?
And so we now have this model of healthcare, which is called a functional medicine integrative model of healthcare. And basically, to define functional medicine is a field of healthcare that employs assessments and early interventions, and the key word there is early interventions, to basically improve the physical, the physiologic, metabolic, and also mental functioning of an individual.
Okay.
And it also is a way to impact that person's life into optimizing their health. So we focus on a couple of key areas.
Okay.
We focus on this idea of biochemical individuality and uniqueness that everybody has based on their genetics.
Right.
And as a person's genetics are different, their body functions in a different way. So we have to recognize every person as a unique individual. We also have to recognize that any symptoms that occur should not be ignored.
They should be reported to your coach, basically.
Yes.
And a lot of people don't realize that they need to remember this and talk to their health coach about it, because they are signals and indicators of what causes should be examined.
And in the functional medicine model, we spend a lot of time really looking at the symptoms and their underlying causes. Because even a minor symptom, if it's ignored over a period of time, leads to this cascade of triggering events that can eventually lead to chronic illness or a degenerative process later in life, if it's been ignored for many, many years. So we must really identify the cause of symptoms early. And that's a big focus of prevention, but also functional medicine is an approach that utilizes that as one of its main components. And so we also focus more on how the body functions and not just trying to put names on diseases or conditions. So our focus is more about how the body works.
So you're looking at the whole body.
And how it functions on a daily basis.
Yeah, okay.
And it's also applied within the principles of a holistic model or holistic care.
Because the way standard medicine is treated today is we've been chopped up into parts, pieces, and organs. And there's a specialist for each one. And most people don't have a single doctor that's overseeing the whole thing.
Yes.
And so they're treating it like nothing's connected, when in the body everything is connected within seconds.
Yes.
So that's why so many the indicators of serious illness get overlooked for so long, is because there's nobody in charge of the whole except the patient, and nobody's told them that.
Yes, yes.
So they need doctors like you, or functional doctors, or holistic doctors who look at the whole. So, okay. So that brings us to the question, what are the principles of holistic health care?
And as you mentioned, that the most important factor is that you have to understand that the body is interconnected. It's physical, mental, it's all the biochemical factors involved. So you have to look at all of those components. We recognize that the body has its own innate healing system. And many times we want to invoke our body's own response through its innate wisdom of the body healing itself and supporting it properly,
right,
rather than working against it in some ways.
Well, rather than a dramatic intervention that the body would take care of on its own if you let it and gave it the support it needed.
Because genetically, your body was programmed for health.
And to heal. You
and
cut yourself, it heals if you don't rub
You have
dirt
many
or
innate processes
yeah.
that are working constantly to always get your body into a state of health.
Right.
And many times we just want to support and allow your body to do what it does best, and heal itself. And we also want to emphasize putting the body into a state of balance. and this
Is
concept
that-
of homeostasis,
Okay, so the term homeostasis is referring to that state of balance, correct?
state of balance.
Okay.
So when the body is stressed and it goes through a period of illness, it's trying to reestablish itself to get healthy, which is meaning it's trying to get back into balance.
Okay.
And homeostasis is that component. So we try to talk about, the big factor is how do you get the body into what's called functional homeostasis?
Okay.
And one of the big questions to address is how well balanced is your body functioning on a daily basis? And so we have many health-sustaining systems in the body that are designed to basically be able to adapt to stress, to be able to regulate, to be able to protect itself from exposures like toxins
Right.
and chemical factors that may be damaging. And our body's doing this to be able to maintain this state of balance. So it has this self-designed regulation system. And we stay healthy when our body's able to regulate itself properly and get back into balance
Right, when those
it's under
systems are
stress.
working.
So every time
functioning.
you're under a stressor, your body has this ability to be able to reestablish itself. And the better we're able to do that over our life, the healthier we will be in the long run.
Okay. So what are some of the imbalances that contribute to that?
Well, one of the things we talk about in reference to symptoms, once again, is that, for example, weight gain is a symptom. A lot of people don't think of it that way. Insomnia is a symptom.
Yes. That's
Fatigue
true.
is a symptom. And so a lot of times we're looking for headache is a symptom. And a lot of times we're looking for that quick remedy.
Fix, right. A sleeping
or,
pill,
or
an
some
aspirin.
kind of solution, a quick solution to let's get rid of the headache, or how do I just try to force my body to have more energy, or how do I lose weight quickly. But we have to realize that there are many underlying causes to weight gain. And it's an imbalance in your system, essentially. When
Right.
your body's not functioning properly and the systems are not regulating properly, there's some kind of a disruption in the regular metabolic functioning of your body, and so therefore you see weight gain. So it's not so much going to be a solution through a diet approach, but we need to unlock and uncover what's causing these disruptions that are eventually causing weight gain.
Well, it could be diet, or it could be metabolism, or even it could be the inability to sleep.
And it could be stress.
And it could be stress, because stress shoots up your cortisol and your stress hormones, and the way for the body to bring itself back is putting in insulin, which makes you hungry. So everybody under chronic stress overeats because their body keeps putting in insulin to bring their stress levels down, and that makes them hungry.
Exactly. So
So-
that's a perfect example of this series of imbalances that start to develop when a person is exposed to stress, and then these series of imbalances start to occur within the body, and you start to see weight gain.
Yeah.
And the good news is that with a functional approach, we can start assessing individuals more along those lines and in determining where those imbalances are.
And working with them to help them figure out how to shift the balance.
Yes.
You know, when I had my owned a PR agency for 10 years, and so in 10 years I put on 10 pounds, and
Yes.
it was just the stress of running the agency. And I hadn't changed what I was eating, and I still exercised, but it was that constant stress.
Stressor.
Okay,
So-
so
So I was going to say, one of the first areas that we focus on really is energy.
okay,
Energy is the key to our life. You know, it's what keeps us alive. It's our driving force. So we spend a lot of time with individuals assessing their energy system. That's probably one of the most important systems that we address through functional medicine. Is how well is your body making energy? Because
that-
we equate energy basically with your vitality, which
happiness.
then which leads to your quality of life.
Yes, yes.
So any changes in energy are going to affect your vitality and your quality of life eventually down the road. So we spend a lot of time in a functional medicine approach really looking at imbalances that are creating fatigue and loss of energy, or we also call loss of vitality.
Okay,
And so it's really the first sign of what's called a cellular imbalance, which can then lead to a progression of chronic disease or degenerative problems. And the first step basically is to start testing your own individual biomarkers to start understanding, where these imbalances are coming from.
Okay, so explain what the biomarkers are, and let's talk about the important ones. We have plenty of time still, and I think this is a real critical thing because most people really probably haven't heard the word so much before or really know what it means. So biomarkers are what?
So very simply, biomarker, bio meaning it's a biological measurement, and it's marking some kind of an imbalance or some kind of a function. And so it really is an objective measure of your present state of health and how your body is functioning, but it also is an indicator of imbalances that are actually creating or causing premature aging. So they're early indicators of the body aging faster than it should be. And an acceleration of some of these processes of aging.
Okay.
And so biomarkers can be very useful tools to be able to assess early on and to identify how well a person's state of health is at that current period of time.
Okay, so talk about these biomarkers specifically.
So
we've got
a
list of 10 of them
many
here.
biomarkers that are available to us to be able to measure. So one that we specifically spend a lot of time with as well is any changes in our level of muscle mass. And it's been found that our level of muscle mass is a very strong determinant of longevity. And also individuals that maintain their muscle mass over their lifespan actually have the greatest ability to live longer and have the least chronic health problems.
Interesting.
So just the muscle mass percent alone, okay, which can be measured through an instrumentation of what's called body composition biomarker assessment.
Okay.
It breaks down your body weight into the components of muscle mass, body fat, and water weight. And the most important number there actually is the percent of muscle mass, or called body cell mass, which is really the metabolically active tissue which keeps us making energy. And if a person is actually showing signs of an acceleration of loss of muscle mass, it's a term we call sarcopenia. Sarco, muscle, and penia meaning a loss of muscle.
Okay.
And so it's a very important biomarker to identify a person early in life if they're showing signs of sarcopenia.
And what causes a loss of muscle mass?
There are many, many factors.
Okay, so name a few.
So there are other biomarkers as well.
Well, can you just name a few of what might cause loss of muscle? Because
that leads us into some of the other biomarkers as well.
Okay.
And so yes, one of the biggest factors that can cause sarcopenia is chronic systemic inflammation.
Okay.
We know that inflammation that's triggered from many potential factors, if it's running chronically in a person's system, has a very detrimental effect on muscle mass.
I thought you were going to say lack of exercise.
That's the first one many people think of.
Okay, well that's the first one that came to mind.
But
so
a person
inflammation.
actually, reducing their activity level will also affect muscle mass. But we find there's a more dramatic effect when individuals are when their body's under high chronic systemic inflammation.
And that's very common also these days, at least in certain age groups. Is it common amongst 30-year-olds?
It can be seen in any age group.
Right.
Because it can be triggered by factors in our environment. It can be triggered by our foods, if individuals are eating inflammatory-based foods, or if they have a sensitivity to a food, which can trigger inflammation. It's also triggered by chronic infections. If a person has been exposed to an infection and it hasn't been cleared from their system, it can be a trigger towards that.
Okay.
And also environmental toxins that we're exposed to.
Toxic overload.
Can be a factor that triggers systemic inflammation. And everybody has a different level of susceptibility.
Okay.
And that's where the genetics come in.
Right.
To some point.
Right.
So that's another biomarker that we assess very commonly with individuals is different measurements, either through blood tests or other measurements that tell us about chronic systemic inflammation.
Yeah.
We also look at a person's energy reserve, or the ability to produce energy on a mitochondrial level. Your mitochondria are basically the power cells of our cells.
Right,
it's
the
where
energy-producing part of the cell.
Exactly.
Right.
So every single cell in your body has a concentration of mitochondria, which are the energy-producing areas. And there can be dysfunctions that occur that limit the ability for the mitochondria to be able to function properly, and you have a lower output of energy production. And so that leads to fatigue or reduced metabolic rate to some individuals, and can also lead to one of the factors that leads to weight gain. And
Okay. And is one of the causes of loss of mitochondrial energy dietary? I mean, I see L-carnitine, an amino acid, often recommended for boosting mitochondrial energy. Does that have validity?
Yes, it surely does.
Okay.
Because we have a direct pathway. Okay, when you look at, there's a new biomarker assessment that looks at mitochondrial function.
Mm-hmm.
And it measures the ability for our body to convert our proteins, our carbohydrates, and fats directly into energy, or called ATP. Carnitine is one of the nutrients that, if it is deficient, you're unable to be able to convert our fats into energy properly.
Right.
So it can identify a carnitine deficiency.
All right.
So we have a new biomarker assessment now that actually measures the ability for our body to make energy on a mitochondrial level, which is fascinating.
So it would be looking at deficiencies, nutritional deficiencies that prevent the body from making the energy.
Energy properly.
Okay, good.
And it's very specific for that person, and it's not
generic.
Generic
Right.
in that regards.
Okay.
We also look at any changes in physical capacity.
Mm-hmm.
Okay, a biomarker of physical capacity is, endurance, being able to walk for a prolonged period of time, being able to do physical work or activities.
And how long you can do it.
And how long you can do it.
Yeah.
So many biomarker tests can measure a physical capacity of a person. Because any changes in postural imbalances or limitations in movements are significant, because they can lead to chronic disuse.
Downward spiral, basically.
Exactly.
One disability leads to more because you're not able to move properly, or you're compensating when you move, and you tend to move less if there's pain or deficiencies.
Yeah, so one of the assessments that we do in the office is to specifically measure a person's physical capacity on many different levels.
Okay.
We look for signs of imbalance neurologically, not being able to balance properly. Classically, many people know biomarkers. A hearing test is a biomarker.
Okay.
An eye test is
All right.
a biomarker test,
Okay.
for example. So
We're not
there's
used
many different types of biomarkers.
We're not used to thinking of those.
Yes.
They came before the word biomarker.
Yes. So we include that as a type of an assessment on
So
the
it's
body.
a very top of the head to the toe, inside out assessment
Yes.
of a person's capability in a physical level.
It's a function, their ability to function. So like a hearing test tells you about the function of hearing. The eye test, same way.
Right.
And so we have these nice biomarkers that give us an idea of how well the body's functioning at an early level in a person's life. We also look at memory.
Yes, I'm familiar with the need to assess one's memory capacity.
And one of the programs that we do in our office is a brain wellness program. And so we're assessing individuals as far as cognitive function, memory, balance, and
I'd be
keeping the
interested
brain
in those
healthy.
tests.
Yes, so those are biomarkers as well.
Okay. Okay.
We also have biomarkers that can assess your immune system, looking for either chronic infections or looking for autoimmune. There's a science of predictive autoimmunity now, which allows us to measure biomarkers that tell us about autoimmune tendencies in an individual, which are early indicators. We also have biomarkers that tell us about hormone imbalance, measuring deficiencies in key hormones like testosterone or DHEA.
Yeah, and I think testing for blood sugar is one of those.
And then a big area with many, because of the tendency or the rise in diabetes in younger individuals, is that we always want to maintain blood sugar within very tight parameters. And the big problem with blood sugar is that it causes glycation.
Okay, explain that.
And then glycation is bad.
Okay, explain why.
and if the blood sugar is elevated in the body for any length of time, it starts to interact with functional proteins in your body, and it causes this process of glycation, which is actually damaging the proteins. And so many individuals know in chronic diabetes or high blood sugar that kidney disease follows, because it's glycating,
or neuropathy.
or it's glycating the proteins in the nervous system in the kidney, and that's what causes damage.
Okay.
So glycation is an aging process that we don't want.
Right.
So blood sugar is very important to monitor. So we have
and
biomarkers.
not just in diabetics, but everybody
And
should
everyone
have their blood sugar
should be
monitored.
checking
Yeah.
blood sugar levels, and there's really good biomarkers now for glycation and also measuring just blood sugar as well.
Okay.
So it goes a
Okay.
step further. And one other very important one that's many times not always tested in many individuals is how well a person can handle their environment. Because we're constantly exposed to environmental exposures from the sun, but also from chemicals and even pollutants in the air.
Right.
And our body has this antioxidant reserve system. Okay, and one of the most important parts of that is a protein called glutathione.
Yes.
And many individuals are very low in glutathione production.
Mm-hmm.
And that can render them at a risk of many chronic diseases down the road. And so we have a biomarker to assess oxidant status and also glutathione production levels, which is a very important connection between the environment and our health.
And you can't just take glutathione.
It's a protein that's made internally,
Right.
and it has a genetic code to it that sometimes people lack the proper genetic message to be able to make glutathione.
Right.
And so we have to do things many times to help that person produce more glutathione
Right.
and work on
Right.
it nutritionally as well.
Right.
But it is a very important marker for environmentally related illnesses in those regards. So it is a biomarker that we commonly measure with many individuals these
And I
days.
think a really important one because and not addressed very often. So
Right.
I think this is somewhat unique amongst holistic practitioners to look at the glutathione.
We are starting to look more and more in the environment and how it affects our health. And there can be a big connection there between the environment and causing illnesses.
Well, and that's because we're all living in a toxic soup.
We're exposed to many things
We
these
are.
days.
We are. Our air is polluted, our water is polluted, and our food, 96% of it gets sprayed with toxins and chemicals. So it's very hard to live a healthy life these days. And so I think that you're going to have a lot of people coming to you for advice and help. So where do you start helping them design a therapeutic, personalized wellness program?
So the first step is actually starting to assess these biomarkers.
Okay.
Because that's really where you start to really get more personalized. You're able to start looking at your individual needs. And so these biomarkers can be a huge benefit to really giving you the information you need to really put together a plan that's much more specific for yourself. And it can have a greater outcome as well. So we also look at the symptom picture more in detail. We start assessing symptoms, as we said, looking for the causes. And so a personalized program is really based on first assessing biomarkers in individuals, which we do as part of a more comprehensive physical examination. And we start to put together what's called a personalized wellness plan. And it includes a couple of key factors. First of all, we have to treat any chronic health problems. And we try to integrate it with other treatments many times, even medical treatments in combination, to be able to manage that chronic health problem. We start to look at balancing our metabolism. What can we do to make the metabolism much more efficient at producing energy? So a wellness plan should always include looking into improving metabolic function, which basically is going to enhance energy and also keep the weight managed very well. We also want to start looking at your genetic risk factors. Many individuals can be assessed based on their genomics. And looking at their genetic risk factors that may, have a tendency to potentially cause a chronic illness later in life.
We have about 10 more minutes, and
Yes.
so I'd like to just talk a little bit about these genetics because I don't think most people understand what's available or why they might, what's involved. Can you just go into that a little bit deeper?
There are certain genomic biomarker tests now that assess very important processes. That the body needs to be performing on a daily basis. And these are processes that may need higher levels of certain particular nutrients to be able to function properly. And so it's not necessarily telling you that you're going to get this disease down the road, but it's telling you that you have an imbalance in your genetics that renders your body less able to make glutathione, or your body is not able to produce enough what are called methylation compounds.
Right, I'm an undermethylator.
and some people
And
have
I
been
know
tested
that.
for
Yes,
methylation.
10 years ago.
And it's actually been found that close to 40% of the population has a methylation problem, or a poor methylator. So it's a genetic tendency, but you can fix that by
Yes.
knowing that you have a methylation fault, and you can improve your nutrition to help that.
Yeah, I take methyl donors for
Yes.
it, and it was part of my mental illness recovery from bipolar, was discovering that I was an undermethylator and that there are 4 genetic errors that contribute to all mental illnesses that have been known since the 1960s, thanks to doctors and
Yes.
running a Canadian mental hospital. And yet conventional standard medicine knows nothing about these. And so that's what I want people to understand, is that this field of genetics is sounding very new, but parts of it have been known through observation and
Yes.
through trial and error by doctors who were looking for solutions 60 years ago.
Yes.
Now there's many more tests, but they don't always know what some of those genetic tests mean.
Right.
So it's still a field where you can, somebody can tell you you need to order 100 different genetic tests at a very high price, and they won't really know how to interpret all of them. So you need to trust the integrity of your doctor who's directing this, because it can be very lucrative and not very enlightening unless you have someone that you really trust, and it's specific to think. Undermethylator, I have a higher risk of cancer.
Yes.
So these do contribute to illnesses, and there's a lot that is known. I'm just giving you a little word of caution that it's still, in terms of all the testing, it's still a relatively new field in some areas, and so you just need to ask a lot of questions.
Oh yes, I mean there's a few methylation tests or a few genetic tests that are very well researched
And done for a long time.
and have been done for a long time, as you
Yeah,
say.
yeah.
So it's not new. It's just that it's coming to light because there's been more research to validate, and so methylation is one of those areas.
And it can be very
so-
helpful. I mean, obviously it helped me a great deal. So don't mean to discourage people. I'm just saying there's, it's
to be
important,
selective.
and you need to be selective, and don't get talked into 100 different genetic
Exactly.
tests. Know what these tests are being recommended, why they're being recommended, and what
Yeah,
might come out of it.
Yeah, it's not designed to be something that is a blanket for everything.
Right.
So we're looking for very specific reasons for it. And as you say very well, that there is a strong connection between methylation and neurologic function and cognitive function.
Yes,
And-
there is. And part of the other thing that I'll just stick in here, because we're not talking about mental illnesses, but I can't resist, is that many of the SSRI antidepressants reduce methylation and increase your risk
Yes.
of cancer as a result of that. So that's just a PS to this conversation.
So we always try to help a person address those issues. And when we find that imbalance, it can be managed quite well nutritionally.
Okay. And then talking about the imbalances of chronic illness.
Yes, and so one of the other areas I wanted to mention is that we, as part of the wellness plan, we try to identify those functional imbalances that we discussed in reference to causative factors that are potentially causing dysfunction and can lead to illness down the road. And then we design a lifestyle program, which is really based more on a complete lifestyle approach. So it's not just a diet, it's not focused on just one particular area, but it's looking at factors relative to improving sleep, improving lifestyle habits, exercise, restoring and rebalancing areas that are showing imbalances that many of the functional tests may show. And one of the things that is recommended is having regular sessions with a health coach to be able to identify these types of imbalances and working on ways to improve and rebalance and help the body get healthy once again.
Great. So give us the keys to living healthy for life.
So there are many keys, as you probably imagine.
Yes. Well.
And I would say on the priority list,
Uh-huh.
energy is really, that's the key.
Okay.
We should have this quest for energy. Every day we live, we want to be doing everything we possibly can to maintain our energy, because that's going to be the factor that has the greatest effect on maintaining our health. And so we need to, at all costs, identify if there's anything at all that's causing a loss of energy or vitality. We need to start recognizing food as nourishment. We need to reconnect.
Yes.
Okay, and realize that our food is nourishing our body, and learn how to prepare whole foods. We need to eliminate and manage pain conditions, because that's a stressor that is very depleting on the system.
And not just tamp down the symptoms.
And not just taking something to try to ease the pain by oral types of medications. We want to develop more stability and physical capacity, okay, improve our body mass, because that leads to better longevity. We want to clean up our environment, reduce our exposure to toxins that may be causing potential imbalances, and helping our body learn how to detoxify better and to be able to clear those toxins. We need to manage stress better and learn stress techniques. And there's many different types of techniques that fit the individual better. And so
find
we
something
try to
that
find
works
something
for you.
that works for you.
Yeah.
Exactly. We want to make activity a natural part of your life. We need to be always moving. Our body was designed to move. We want to help our state of mind. Keep our body in an optimistic and hopeful, caring, and positive state of mind. We want to create an awareness of our body's own goals. Self-actualization. Become aware of the goals that we want and to move ourselves in that direction.
Right, in your mind what you hope for and want your life to be, and then have a plan to steadily move towards it.
It gives you purpose. It gives you the reason to
get up.
Get up and go every day.
Right.
And we want to test biomarkers to start understanding your unique body type, your individuality. And that's where the personalization really comes to play. And look at a physician as a health coach, teaching about these
and a collaborator, someone you collaborate with and you work together for your goals.
Yeah, the goal is not to just go to a physician when something is hurting, but when you want to get advice on how to live a healthier life.
Okay, so we have 2
minutes. And
then
you want to create your own blue zone.
What's a blue zone?
And blue zone is areas in the world, globally, where individuals live a very high quality of life and they live over 100 years.
Hey, that's a great goal.
And so you can create your own blue zone home.
Right.
And so we talk about individuals developing their own blue zone in their own home. A comfortable, healthy environment where they can sleep well, regenerate, have a place to prepare foods, bring over friends, enjoy, laugh with conversation, and live in a blue zone type of approach, which can lead you to live to 100 years.
Well, you are certainly the perfect example of that. You're high energy, you're the picture of health, and you exactly know how you got there, and you continue to maintain it. And I'm so grateful for you to come and share all of this with our viewers, and for your wonderful positive outlook. Thank you so much for being here today.
Thank you very much.
I want to remind viewers to please, next week there's going to be a free open house at Colleen Clabby's the Mystic Gathering Center, and it's a spiritual health care and retreat open house on Sunday, January 11, from 11 to 4 p.m. And her show will be airing in mid-December into early January on this station, but the open house will follow that. So mark your calendars, and then please tune in next week. Dr. Rosenberg's show will be on holistic diabetes and pre-diabetes treatments. And so this is for all of us who have family history and inclination to become diabetics, and what we can do to prevent it and what you can do about it. Thank you for joining us, and good night.